So yes, thanks again, Dr. Robertson. You gave us a lot of food for thought, and I'm sure there's some of us that look like Scar in morning traffic, but there's some of us that are in control and we plan a podcast or an audio book while we're driving to work because we know it's nothing that we can change, right? So thank you for that, and I'm sure you left us with a lot of self-introspection. So now, our final presentation before lunch will be from Hylton Grace, Correctional Counsellor and the Cayman Islands government. He's going to be presenting on mental health first aid in the Cayman Islands, making every conversation matter. Help me welcome Mr. Hylton Grace.
All right, good afternoon, everyone. Beautiful presentation, Dr. Roberts. Now, making every conversation matter is indeed a very important issue for all of us. As I scan the room, I notice a number of my colleagues who are in mental health. But the vast majority of us here are not mental health professionals. We are ordinary people. We are parents, sisters, teachers, friends, etc. And just as Dr. Robertson spoke of the radical acceptance skill, mental health first aid provides a number of skills that we can use to practice that can help us to notice what is happening with our youth, etc. And I need a bit of assistance with this. You know what? There we go. All right. Now, many of you in here would have had this situation where something was happening with someone, but we weren't exactly sure what was happening or how to actually address that. In reflecting, the APF looking at lighting the way, turning hope into action, we know that it's not always about having the answers because you're not necessarily a mental health professional. We don't have all the answers anyway. It is more about being open and willing to learn and being brave to start a conversation with someone who may be getting worse from a mental health condition or someone who might be developing a mental health condition. Hence, we have mental health first aid. There we go. Now, mental health first aid is CPR for the mind. And what do we mean by that? It is that thing where we have an action plan that we're going to discuss shortly about how do we, again, assess people. An assessment is not these huge things that we do. We can do it through observation. We are going to talk about how we listen, how we approach individuals so that we're able to direct them where we need to get to. Now, why are we talking about that is mental health conditions are universal. Every single one of us here would have experienced some type of mental health issue at some point in time, right? And whilst many people don't necessarily want to be fixed, they want someone to be able to listen and to perhaps tend to their moments of vulnerability. Mrs. Spanton spoke of that earlier in terms of exercising active listening, all right? Now, mental health first aid is internationally known. It is accredited, and it is for ordinary folks like many of us. So let us talk about what that looks like. In fact, currently, the Cayman Islands recently got licensed as a mental health first aid licensee, so we're able to roll out that program throughout the entire island for ordinary folks, not necessarily mental health practitioners, right? And why that is important is that we want to create a society where in every school, in every home, every place of employment, someone exists there who will have some basic skills of how to identify and perhaps intervene when someone is experiencing a mental health condition. And so the action plan, thank you. The action plan we call ALG, and this is something that I hope that you remember. And it is an acronym, all right? It's approach, assess, and assist a person who might be developing a mental health issue or is getting worse from a mental health issue or experiencing a mental health crisis. Now, the crises sometimes are a little bit quicker to deal with because we always have 3 numbers at hand. You all know that one, right? 911 often, right? However, the listening and the approaching can be slightly different. So, how do we approach someone? We have to look at timing. Timing is very important. We have to look at how do we engage the person using the assessment skills, which are simple. How are you feeling? Okay. You don't seem like your usual self. Help me to understand what might be happening. With just those questions, you have assessed a situation. Prior to that, you may have observed that this person is not being themselves. So you have assessed, you have approached, and you are about to assist this person with what is happening. Now, does not sound really difficult, does it? And it is very important that we're able to start to engage this as ordinary persons, because oftentimes when we hear mental health, we kind of want to back off instead of facing it. But through mental health first aid, you will develop these basic skills which are able to help you to actually approach, assess, and assist an individual. Now, I think Mrs. Panton also spoke about the issue of listening and communicating non-judgmentally. When people are telling us what is happening in their lives, we like gossip. We like the juicy stuff. You know, I say, really? That is what's happening? All right? Listening non-judgmentally is really about empathy. I can see that you are disturbed by this, or that seems to be overwhelming. Again, my go-to is, how might I help you to address this? Because we have to start from the standpoint that many times people who are experiencing mental health conditions, we can't disempower them. We have to empower them. So they also play a role in their own treatment and development. So help me to understand this further. You know, again, it says, it sounds like you're feeling overwhelmed. How have you been coping today? I just have a colleague who, experiencing some grief. And I ask her, how are you doing today? And she's like, I'm really not okay. And I listen further. And I ask her, what strategies do you have in place? She's like, oh gosh, I have none currently. So I sat and I listened. And by the time we finished that, it didn't change anything dramatically, but presence was important because I listened and I did not judge. Because, again, this person is a mental health professional, but again, these skills have to do with every single one of us. Information generally is available. Anyone here is not aware of a place called Alexis Place? Anyone here not aware of that? Anyone not aware of the Department of Counseling Services? So there is general information, but the issue of support, being available, practical support, being able to say, okay, all right, so what are you going to do about this? Practical support in terms of, I could accompany you here or there, because we have a lot of information that we can share. the support part is where it's really important. And then also listening to persons further in saying, I appreciate you for sharing this with me. Let us see how much further we can go. So give support and information critical. We have lots of information, but let us work on that support by being available. And also one of the key things about mental health first aid is that you will learn how to spot some of the symptoms. You know, that our good doctor spoke about earlier. You will learn, again, because we're looking at close relationships, whether it's at work or at home, you will know when someone is not operating at an optimal level. Now, when you combine your knowledge of the person plus your knowledge of mental health first aid, it offers you that opportunity to say, okay, this is how I might be able to support this person. Now, encouraging other support is about the strategies that we can ask persons about what they're doing or who else can help. A beautiful thing about mental health first aid and why it's key, especially for persons who are not mental health professional, is that you are not the one providing the treatment. So understand what you're doing is you're assessing, you're identifying, and pretty much you're referring. So you're not providing the mental health treatment to the person. And that is key because oftentimes we feel we can't enter or we can't engage with the person because you don't know what to do. What you need is the information and also to understand who provides what types of services and be able to deliver that. So again, speaking about coping strategies that they might find helpful, that radical acceptance is a beautiful one to acknowledge that, hey, this is happening. And because this is happening to me right now, then, and I've accepted that it has happened, what are my options? How might I go about addressing this? Now, it's important also to acknowledge the fact that persons do have other people in their lives who are able to help them. So you ask, who else in your family or what, is the spouse a good support in that regard? Who else can you trust with feeling this type of support? And what you're really examining with the support is you're looking at the ecosystem of the person and trying to figure out does that level of support exist? And you're just simply redirecting them into that ecosystem. Okay? And that is, as we said, encourage other support. Now, sometimes that support is in a clinical office. Sometimes that support may be just offering that person some information. Again, with learning mental health first aid, you'll figure out, okay, where and what. Now, we encourage other support and we also encourage professional help. We had Dr. Stennett who spoke about the power of medication. I know medication issues are often contentious, but oftentimes encouraging the support of professionals, whether that is a psychologist, a counselor, a psychiatrist, it is important for us to encourage professional help. And that's why also, again, as a mental health first aider, your role is very, very clear. You're not providing the service, but you are indeed directing the person to this service. And one of those services are where do professionals exist? What types of services that they offer. Sometimes people mix up the roles of a psychologist and a psychiatrist. Sometimes you can explain that if you have that knowledge. But it is to know what organizations exist, the types of services that they offer, and be able to encourage the person to seek that professional help. But then sometimes professional help can also be about lifestyle. We have a beautiful beach out here, for example, with lovely facilities for exercise, right? There are also support groups that we can speak to persons about. So we're looking at, again, that ecosystem of support that includes professionals, That includes family members. I'm in the government system, so there's always EAP, and there are a multitude of private organizations providing various kinds of services, many of whom are here today. So through mental health first aid, as a first aider, you're able to really assimilate that general information and be able to direct persons as they come to you, starting really and truly with people in your family, then people in the workspace, and then even with strangers, because you can sometimes detect when someone, something might not be sitting well with an individual. So some persons might need that additional care, whilst others might need smaller amounts of care. Sometimes it is just that engagement. A beautiful thing about mental health first aid, especially if it is with a person that is known to you, if there's not an assessment of a crisis, a mental health first aid does not have to occur as in immediate. It's not like you do it in one sitting. It could be over days. It could be over a few weeks, depending on the severity of what is happening. But then again, as we say, as long as there's crisis, 911 is the appropriate number that we dial, or we hand that person over to someone who is able to actually address that. Now, let us look at what happens when mental health first aid is really rolled out across the Cayman Islands. We're looking at workplaces where leadership knows how to respond. The HR, but not just the HR, because we push a lot of things at HR, but then HR as well as line managers, people who are dealing with people, right? Parents who feel confident about asking difficult questions. One of the questions many people try to avoid at all times is, what if someone discloses that they're having suicidal thoughts, or what we call suicidal ideation? A lot of people shy away from that. In mental health first aid, you learn exactly how to respond to that, to those types of difficult questions, right? Again, with mental health first aid, we would reduce stigma and encourage collective and community responsibility. Schools where all staff are more knowledgeable on how to intervene early. Early intervention for whatever issue that we're facing is always a great idea. If you intervene early, that's primary prevention, so things won't escalate much further. And this is the vision that we're working on through rolling out mental health first aid. We're looking around about June or so to start rolling that out. Now, let us turn hope into action. We started out asking if you have ever known someone who wasn't okay, but you didn't know what to say. And I ran through this tool, which is the action plan, the ALG, and I'm going to go through them just one more time for you to start thinking about. And these are tools that you can actually integrate this very day. Being able to approach a person, assess and assist them with a mental health condition or a mental health crisis. And your assessment tools, how are you doing? What have I noticed? What is going on? Right? Approach, it requires timing and some finesse. You don't necessarily want to approach someone in the middle of a busy street necessarily, right? Or in areas where they might feel a bit embarrassed, right? So offer the person some sense of privacy, right? Even if it is urgent, being able to take the person aside. Listen, we all have this, and communicate non-judgmentally. And that is, I hear what you're saying. You engage empathy in that. This seems overwhelming. How might I help you? Give support. I am here for you. That you see that physical presence sometimes without even talking? That giving support says, I am here with you. And I care about you, and the person is hearing, I am valued. That level of support, but then also information about what services are available. Have you ever thought that, thought about getting an assessment in terms of, anxiety or depression or anything like that? That is giving information. Brochures, you'll get a lot today. Share those when you go home. That is sharing that information. Encourage a person to get appropriate professional help. These are complex issues that requires professional help. And so don't believe that you can get up and you can resolve this, because again, these mental health issues develop over time period, and so you want a professional who is trained in the area, so you direct the person to get that help. And then you encourage other support. If it's a child, school, again, looking back at that ecosystem. Where do the children hang out? Where do they congregate? They go to school, they may be involved in church, they may be involved in extracurricular activities. Who are the point persons within those areas that can assist this person? Again, when we're looking at adults, we can, there are other ways and means. So it starts with one conversation, and then every conversation matters at the end of the day. So I encourage you to look out. You'll be hearing some announcements very soon, but when we are ready to go and roll out mental health first aid. Thank you very much. I hope this has helped.